Welcome to this lecture on the basics of neuroscience, focusing on the cranial nerves. If you have ever wondered how you can instantly taste a sweet apple, feel a breeze on your face, or hear a sudden sound, the answer lies in these remarkable neural pathways. Today, we are going to explore what these nerves are, how they function, and why they are absolutely critical to our daily survival and clinical medicine. Let us dive in. To understand cranial nerves, imagine your brain is the CEO of a massive corporation, which is your body. Most of the CEO's orders go through a main central cable, known as the spinal cord, to reach the rest of the building. However, the CEO also has a set of 12 special direct VIP hotlines that connect straight from their office to the most important rooms nearby, like the security cameras of your eyes and the microphones of your ears. These 12 direct hotlines are exactly what the cranial nerves are, bypassing the spinal cord entirely. Now that we have our analogy, let us look at the anatomical definition. In neuroanatomy, cranial nerves are a set of 12 paired nerves that emerge directly from the brain and brainstem, rather than branching off from the spinal cord. Because they are paired, you have one for the left side and one for the right side of your head and neck. Scientists and doctors designate these nerves using Roman numerals, 1 through 12. This numbering system is not random. It is based strictly on their anatomical location, moving from the front to the back of the brain. Building on that numbering system, let us trace where these nerves actually originate. As we move from the anterior, or front, to the posterior, or back, of the brain, we encounter them in order. The first two, the olfactory nerve for smell and the optic nerve for vision, emerge directly from the cerebrum, the highest part of the brain. The remaining 10 nerves emerge from various lower parts of the brainstem. Understanding these specific pathways is fundamental for doctors. If a specific nerve fails, knowing its exact origin helps pinpoint exactly where a neurological lesion or tumor might be located. So, what exactly kind of information is traveling through these pathways? Cranial nerves are responsible for conveying sensory information, like touch or vision, from your head to your brain. They also carry motor commands from your brain to your facial muscles, allowing you to chew or smile. Some of these nerves are purely sensory, some are purely motor, and others are mixed nerves, meaning they handle a combination of both. Beyond just moving muscles and sensing the environment, they also control vital autonomic functions, which are the automatic processes that keep you alive without conscious thought. This brings us to why cranial nerves matter so much in our daily lives and in clinical settings. They are the absolute foundation of how we interact with the world. In a hospital, doctors use cranial nerve exams as a rapid, non-invasive window into the health of a patient's brainstem. For example, if a patient suddenly cannot move the right side of their face, a doctor immediately knows to check the facial nerve. Furthermore, without these nerves, we would lose vital autonomic functions, such as the vagus nerve's critical control over our heart rate and digestion. To evaluate the health of these nerves, we must measure how well they function mathematically. This is where the concept of nerve conduction velocity comes in. The formula is V equals delta X divided by delta T. Conceptually, this is the standard physics equation for speed applied to biology. The variable V represents the nerve conduction velocity in meters per second. The symbol delta X represents the physical anatomical distance the electrical signal travels along the cranial nerve, measured in meters. Finally, delta t represents the time it takes for the signal to travel that distance, measured in seconds. If the protective myelin sheath around a nerve is damaged, the time delta t increases, which causes the overall velocity v to decrease significantly. Now that we have our formula, let us see this with a concrete example. A neurologist is testing a patient's optic nerve using a visual evoked potential test. We are given that the total physical distance the visual signal travels along the optic pathway is 0.15 meters. The time taken for the signal to arrive at the visual cortex is 0.003 seconds. We need to find the conduction velocity. We substitute the given distance for the numerator and the given time for the denominator. Dividing 0.15 by 0.003 gives us a final answer of 50 meters per second. This healthy speed confirms the nerve's myelin sheath is intact, ruling out demyelinating diseases. Before we look at our next calculation, we need to understand what happens when a nerve is not healthy. The trigeminal nerve is responsible for facial sensation and motor functions, like chewing. Normally, a fatty layer called the myelin sheath acts as an insulator around the nerve to speed up electrical signals. However, in diseases like multiple sclerosis, the patient's immune system attacks and destroys this myelin. This process, called demyelination, causes a pathological slowing of the nerve signal. Let us look at how we can mathematically diagnose this exact condition using the velocity formula we just learned. In this clinical scenario, a patient with suspected multiple sclerosis undergoes a specialized blink reflex test to check their trigeminal nerve. The physical distance from the stimulation site on the face to the brainstem is 0.12 meters. Because the nerve has lost some myelin, the signal takes 0.004 seconds to reach the brainstem. We are asked to find the patient's actual nerve conduction velocity. We divide the anatomical distance of 0.12 meters by the patient's recorded travel time of 0.004 seconds. The final answer is 30 meters per second. This step reveals exactly how the disease is currently affecting the nerve. Now that we know the patient's velocity is 30 meters per second, we need to establish a baseline for comparison. We are given that the normal conduction velocity for this specific nerve pathway is 60 meters per second. Notice that the patient's speed is exactly half of this healthy speed. To find the exact delay, we first rearrange our original formula to solve for the variable of time. Time equals distance divided by velocity. We divide the distance of 0.12 meters by the normal healthy velocity of 60 meters per second. The final answer is 0.002 seconds. This incredibly fast time represents the optimal functioning of a healthy nervous system. Finally, we can determine the exact time delay caused by the demyelination. We are looking for the difference between the patient's impaired state and the healthy baseline. We take the patient's actual recorded time of 0.004 seconds and subtract the normal expected time of 0.002 seconds. The final answer is a delay of 0.002 seconds. While this seems like a tiny fraction of a second, in the world of neuroscience, this delay is massive. This mathematical difference perfectly explains why the patient might be experiencing numbness or altered reflexes, serving as the direct clinical signature of demyelination. Having calculated how these nerves function, let us visually map where they live. You're looking at a ventral or bottom-up view of the human brain and brainstem. Notice how the 12 pairs of nerves emerge symmetrically on both the left and right sides. At the very top, emerging from the cerebrum, you can see the olfactory and optic nerves, labeled Roman numerals 1 and 2. As your eyes move down the diagram through the midbrain, pons, and medulla oblongata, you see the remaining 10 nerves branching out. This diagram beautifully illustrates how these nerves act as direct communication lines, completely bypassing the spinal cord visible at the very bottom. We have covered a lot of ground today, so let us review the most important ideas. First, remember that cranial nerves are 12 pairs of specialized high-speed nerves that emerge directly from the brain and brainstem. They bypass the spinal cord entirely to control our most critical sensory and motor functions. Second, we learned that measuring nerve conduction velocity allows us to mathematically quantify the health of the myelin sheath. Finally, by understanding these pathways and calculating signal delays, medical professionals can accurately pinpoint neurological damage and diagnose complex diseases. Mastering these concepts is your first major milestone in understanding the beautiful complexity of the human nervous system.